Ralph Waldo Emerson said, "The first wealth is health," so it is important to make sure that every human being could have an equal opportunity to receive health care. Immigrants are estimated to be about 13% of the total U.S. population. When the U.S.-born children of immigrants are added to that figure, this proportion increased to 25%. This graph shows the increase in immigrant population from 2009 to 2013. The barriers to healthcare affect many U.S. residents, but for immigrants, these difficulties can seem overwhelming. If you are an immigrant in America, you face high hurdles to healthcare. Language barrier is and will always be the biggest problem for immigrants, like completing paperwork. Technical medical terminology, understanding instructions, even making an appointment over the phone can deter immigrants from seeking medical care. While many factors put quality health care out of reach for immigrant families, none is more fundamental, widespread, and harmful than poverty. Legal status is another barrier to deter immigrants to seek health care. If you are an undocumented, uninsured immigrant, you face potential deportation if you try to obtain medical care for yourself or for your children. Imagine the fear of being separated from your children when they need your care the most, or when you are seriously ill or injured.
We're the safety net in society. We're an institution of last resort for so many people.
Come on, sit with me. Do you want to see the doctor today? So we're putting your DKA at 7, we're putting 7 and 3, we're putting 3 in the hallway.
This is my first time being in the hospital.
All right, well, congratulations. Tell us first.
There is fear, isolation, and confusion, but there are also compassionate people who want to help meet the healthcare needs of immigrant residents. They volunteer at health fairs, donate medical supplies, and serve as translators. For example, consider the couple in Phoenix, Arizona who purchased a house and converted it into a medical clinic for the underserved in their community.
Our patients are for the most part working poor. The vast majority of them are first-generation immigrants who aren't eligible for other services. And so these are people who really don't have access to health care through any other way. Doing labs on site is an important part of what we're about. Diabetes, high blood pressure, and cholesterol are the 3 that we're really focused on treating. You know, that's what kills most people in this country is these 3. And there's so many people in our community that can't afford the treatment. So we really believe that if we can give people good care for those 3 things, then we can save a lot of lives.
Even small communities like Auburn, Alabama can support medical clinics for uninsured residents.
There were other doctors that really had the same passion as he did and wanted to make a difference in people's lives. We have probably about 15, 16 doctors now that come. You know, you almost have to have a heart for the people to be able to want to be here. And so most of the people that work here are volunteers.
Concerned with advocating for immigrants in our society. And I wondered if y'all see very many.
We have started, here. Yes, we have started to see more of that in the last couple years. And,
do you ever have trouble with language?
Yes, we have an interpreter who we call. We always ask if they can bring one with them, but if they can't, then we have a lady that we call that comes in. She's actually a patient. And we do have a lot of people that donate medicines to us. Doctors, the hospital, lots of places will donate medicine to us. We've been here long enough, about 16, going on 17 years. And so people now, a lot of people know about us, and so they donate medicines that we can, and it seems like God provides.
Immigrants make positive contributions to their adopted country. Pamela Goodsman, the child of immigrants, is contributing to her community as a nurse at UAB Hospital in Birmingham.
My parents are Hispanic immigrants. My mom didn't speak very good English. My dad spoke a little bit of it. And when they had doctor's appointments, as the oldest child, I had to go with my mom to the doctor's appointments, like the OBGYN, and translate everything for her. I would have to get withdrawn from school to go to the appointments, and if I had enough time to go back to school, then I would go back. Otherwise, I would just stay out. And as a child, I didn't really know all the medical terminology or any of the things that the doctors were saying, so it was hard for me to understand what they were trying to break down to me, and then for me to break it down to my mom. And now that I'm in the medical field, I've made an easier transition into doing that for other people, and I'm glad that I'm able to help those that have barriers in their language in the United States when it comes to critical care or any kind of care for that matter.
Martin Luther King Jr. said, "Of all the forms of inequality, injustice in health care is the most shocking and inhumane." Shouldn't people have access to health care? A healthy society is a happy society and a more productive society. Find ways to serve those who have no access to health care in your community. The opportunities are there.